Hello, I'm Dr. Dominique Dempah. I'm a general surgeon with LewisGale Physicians. My emphasis is foregut surgery, which means the upper part of the abdomen, which includes the liver, the pancreas, and the esophagus. So talking about the Whipple procedure, for example, somebody undergoes a Whipple procedure typically when they have pancreatic cancer. And this is dealt in a multidisciplinary way. Which means that aside from the surgeon, the medical oncologist, the radiation oncologist, nutritionist, there's a whole team that is involved in the care of the patient before I even get to do an operation. The patient sometimes will have to undergo chemotherapy or radiation before, so we can assess the tumor. And once we're comfortable that we're dealing with a process that could be resectable, then we decide on the surgery. Now, while they go through that process of evaluation and potentially chemotherapy or radiation, things like nutrition and exercise are very important to gear themselves up for surgery. All that work that's been done prior to the operation will serve them as far as the recovery period. The operation itself includes removal of the head of the pancreas along with the duodenum, a removal of the end of the bile duct, and then we have to reconnect all those parts together. It is an extensive operation with typically an extensive recovery, traditionally 7 to 10 days in the hospital. But on well-selected patients that are able to undergo this procedure in a minimally invasive fashion, this post-operative recovery and this time in the hospital can be cut short a few days. And more importantly, the stress on the patient could be diminished. It is our goal and expectations that the patient return to as functional a life as possible. My philosophy in doing so is to help the patient before and after surgery and to help guide them along that journey.